Welcome to Chat Plat with Dr. Naaman and Dr. White at Chattahoochee Plastic Surgery, located at 2430 Brookstone Center Parkway in Columbus, Georgia. Walking into a plastic surgery office can be intimidating, often making one nervous about the prospect of having surgery. To provide their patients with the utmost comfort and care, Dr. Naaman and Dr. White at Chattahoochee Plastic Surgery specialize in cosmetic and reconstructive surgery. Their goals are to have their patients feel comfortable and at peace from the moment they arrive at the office. The layout and decor have been chosen with you, the patient, in mind, creating what they hope is a warm and inviting atmosphere. As education is the main focus of an initial consultation, they use media and technology as a complement to their staff in providing the information needed to make a decision about the procedures in which you are interested in. The Surgery Center, also known as Brookstone Ambulatory Surgery Center, and the spa known as Naaman Spa are adjoined to our building for your convenience. Chattahoochee Plastic Surgery is located at 2430 Brookstone Center in Columbus, Georgia.
Hey, this is Dr. Vincent Naaman at Chattahoochee Plastic Surgery, and I'm here today to tell you about my practice, about ourselves, the doctors who work here, and about some of the things that we're doing. So sit back and relax, and let's hear a little bit about Chattahoochee Plastic Surgery. We started in 2002 here in Columbus, Georgia, as a solo practice in plastic surgery. Since that time, we've grown and expanded. Now we have two doctors, myself, Vincent Naaman, and my partner, who you meet later, Dr. Shanita White. We're located here in Brookstone Center Park, where we have a surgery center as well as a full clinic. I'm originally from New York City, and in 1995, after all my training was completed, we moved here to Columbus, Georgia. When I got here, I joined a group practice, and after about 7 years, left that to start Chattahoochee Plastic Surgery back in 2002. I went to Stuyvesant High School. From there, I went to Princeton University, continued my education at the Albert Einstein College of Medicine, general surgery training at the New York Medical College, and completed my plastic surgery fellowship at the Mayo Clinic. I am married. I have 4 children. They're all grown up, and I've been enjoying plastic surgery here for 21 years. So one of the exciting things about plastic surgery is the fact that it's always changing. All you have to do is pick up any kind of magazine and newspaper, and you read about the new things that are happening in plastic and cosmetic surgery. One of the things that we're awfully proud about and excited about here at Chattahoochee Plastic Surgery is our use of Thermi. Thermi is a technology that uses radio frequency energy to provide heat to tissues. So what does heat do for tissues? Well, it depends how we use it. One of the technologies we use is called Thermi Tight. Thermi Tight is used to tighten up skin. And the way it's used is a small probe goes through a needle stick, usually in the neck, sometimes in the arms, and heat is applied to the undersurface of the skin. This temperature is being carefully monitored with a thermistor internally and an infrared camera externally. With a combination of those two technologies, we're able to get the temperature to the exact amount that would cause skin tightening without causing skin burning. In a 20 to 30 minute procedure that's done under local anesthesia, we're able to tighten the skin and provide a more youthful appearance for our patients. The nice thing that they like is that they didn't have to go into general anesthesia. There were no big incisions, and the recovery is pretty quick. The other thing that's exciting is that the results get better month by month. So by 3 months, we're watching the results get to about its peak at that point in time. Now, how long does this last? Most people are saying it lasts up to 18 months, maybe even 2 years. And after that, you might need a small touch-up procedure. So this is a great alternative to some of the more invasive procedures like neck lifts that we generally would do, and still offer in some cases. But for those who have a more subtle effect, the Thermi Tight could be a great alternative. On the same line with that is something called Thermi Smooth. Thermi Smooth is even less invasive because it's working on the surface of the skin, so there isn't even a puncture incision. What that will do is help to smooth out fine lines and wrinkles, typically around the eyes, sometimes around the mouth as well. In what is usually a 20 to 30 minute procedure, heat energy is applied, again, carefully monitored to avoid burning, and this is done on a weekly basis for about 4 weeks. With that treatment, you're going to see smoothing results that can last, again, up to a year to 18 months. Well, this is my esthetician, Kaylee, who of course doesn't need these procedures, but I will use her face to show you how we do this Thermi Smooth procedure. So if for patients who have lines, fine lines around the eyes, we can do the Thermi Smooth just below the eyebrow, around the lower lid to help smooth that, out here in the crow's feet area as well. And then oftentimes patients will have problems in this area we call the nasolabial fold, the marionette area, lines around the lips. all those can be improved as well with the ThermiSmooth procedure. Now, we talked earlier about the ThermiTight. That would be for patients who have thickening of the neck, small jowls starting to form, not extensive, but pretty moderate. And we can go in with small incisions, actually needle sticks, just below the earlobes, and one just below the chin. And from those needle sticks, we're able to put that probe, apply the heat, and tighten that skin. It's often combined with a small amount of liposuction. But the neat thing is that can all be done under local anesthesia. Now, the ThermiSmooth for the eyes and around the mouth, that's done without anesthesia at all. Lots of women are talking about this because apparently it's a very big problem that hasn't been fully addressed with non-surgical techniques before. Thermiva is helping women who have problems of stress incontinence. That's a big word to just say problems with leakage. So women who, for example, have had 2 or 3 children and don't have the strength down there near their bladder they used to have, they find that when they exercise, they go on a trampoline, or even if they laugh or sneeze, they're going to have a little leakage. And in fact, they're selling a lot of feminine products now to help avoid the embarrassment, to absorb some of that fluid. But the best thing would be to not have that problem in the first place. There are a lot of things out there. What's good about the Thermiva is that it is non-invasive, it's very effective, it takes about 30 minutes, it's one treatment once a month for 3 months. That will give you effects that will last up to about a year. After a year, one more treatment will be a touch-up to maintain the effects. The good thing is that, again, it's not invasive, it's not painful. You can go back to your normal activities right after the procedure.
Is this the same as rejuvenation?
Well, yes, it is, because while you're tightening up the top of the vagina that will help with the leakage problem, you're also creating a tightening effect in the entire vagina, as well as improving moisture. Because a lot of women, as they get older, estrogen starts going down, they're producing less and less moisture in that area, which makes it difficult for intercourse and so forth.
So you have a lot of patients come in complaining or concerned about their sex drive, or that intercourse does hurt when they're having with their significant other.
So interestingly, some patients do come in with concerns about intercourse, about using lubricants because they're so dry, but other patients just have the stress incontinence, but in the course of being treated, they come to realize that their sexual life has improved greatly as well. Well, we're going to see problems with this stress incontinence in anybody down to the mid-30s, especially if you had 2 or 3 kids, particularly large kids, and particularly if you have vaginal delivery as opposed to C-section. So all of that's going to put, more or less wear and tear on the parts down there.
And you find a lot of women are so happy with what they've come by using this procedure.
We've had patients who've come in who normally have to buy products because of leakage. And the same day, the next day after having the procedure, they find that they don't need those products, or they haven't leaked when they thought they would, or they haven't had to go to the bathroom as frequently as they did prior to the procedure. So the effects are pretty dramatic, although let me just warn you, this is not for severe stress incontinence. We would say it's more for mild to moderate stress incontinence. But seeing as it's non-invasive, it certainly is worth a try as compared to surgical or invasive techniques. I'm so happy to be sitting next to our new doctor here. This is Dr. Shanita White, our new plastic surgeon, and we're so excited to have her. She's brought so much into our practice in just a short time that she's been here. So let's learn a little bit about Dr. White. Dr. White, tell us a little bit about where you're from and how you found your way to Columbus, Georgia.
Okay, well, I'm originally from Atlanta, Georgia. I did my general surgery training in Washington, D.C. I then went and did my plastic surgery training in Detroit. And then I was looking around for jobs, and I'm from Atlanta, so I was kind of looking in Georgia, and then lo and behold, I came to Columbus. I really like Columbus. It has a lot of what Atlanta has. It's kind of a smaller town, not as much traffic. Everybody was really nice. I love Dr. Naiman. So it was a really, really good fit for me.
Excellent. So tell us about some of the things that you do here that you enjoy the most, or what your favorite procedures are.
Well, I'm not sure I have a favorite. I mean, I do all the reconstructive procedures as well as cosmetic procedures. We do a lot of breast reduction surgery here, so we're able to help a lot of patients who have neck pain, back pain, so I really like that procedure for that reason. The same thing with breast augmentation. We have a lot of patients who may not be happy with their breasts, may think they're smaller, so we're really able to give them a confidence boost by doing a breast augmentation.
You seem to have a real heart also for the patients who've suffered with breast cancer and are coming to you for
Yeah.
reconstruction. Tell me about that.
Yeah, absolutely. I love doing breast reconstruction. It's probably one of the procedures that's kind of near and dear to my heart. I actually have a stepmom who went through having breast reconstruction surgery and dealing with breast cancer. So it's something that affects a lot of women. So I'm glad that we're able to give these women some of their form back.
What are some of the new things that we're doing with breast reconstruction now that wasn't available 5, 10 years ago?
You know, I would say fat grafting has probably changed a lot of what we do. And that's when we do liposuction, we're actually able to harvest the fat and then put fat in different places. And of course, in this case, we're talking about doing it for breast reconstruction. So that's really added a lot of what we can do. Also using alloderm. A lot of people don't know about that, but it helps with the overall shape and form of the breast.
Awesome. And then patients often wonder, well, do I have to come back to do all this reconstruction, or can it be done all at once? What's been your experience in that regard?
You know, it really depends. It's going to vary by patient. There are some patients where we are able to do the mastectomy, which is when we remove the breast tissue, and then we're able to put in an implant right away. There are other patients where we do have to do delayed procedures where we may put in what's called a tissue expander and expand that tissue before and then put in the implant later. And it depends on whether they're getting radiation and some other things.
Awesome. So tell me a little bit more about living in Columbus, Georgia. I mean, this is a tiny town. You come from the big city of Atlanta. You lived in D.C. You lived in Detroit. Tell us a little more about that transition. How hard is that?
I honestly really like Columbus. I mean, Columbus is like the second largest city in Georgia, so it has a lot to offer. I think it's a growing city. Like I said, it's not as much traffic. People are nice. I mean, I love it.
Well, we're certainly glad you're here. And we talked a little bit earlier about the Thermiva procedure, but you're actually the one who's doing most of these procedures. Give us a little more insight about that.
I honestly really love Thermiva. I think I have had a lot of patients come back for second and third treatments, and they're telling me that it's really, really making a difference, particularly my patients who have incontinence. So, you know, patients will tell me that they're not able to exercise, they're not able to take road trips. So those are things that we're helping with. They're coming back saying, I took a road trip, you know.
Oh,
so,
that's
yeah, so that's great. That's
Well,
great.
I want to make a little segue because here we are talking about what we do for women, and we do plastic surgery for men also because, hey, you know, we can't leave the men out.
Yeah, absolutely.
I mean, it's not like we're close to perfect, but we're not exactly perfect. So there are some things, you know, it's funny. One of the most interesting things I do with men is working on that midsection. You know, a guy can stay in great shape. Somehow, it's somewhere between the beer belly, the money belt, that little extra something on the side. I might have to get Dr. White to help me out a little here, too, in a little while. But those areas work well, and especially because we're in a military town. I don't know if you've seen this yet, but these soldiers are getting sent out of the military because their waist size is too big compared to their neck size. So we got two choices: either make their neck big or their waist smaller. I think the waist small is probably the easier option, I guess. But anyways, we've gone in there, suction that fat, and they get their tape test. They pass their tape test. They continue in the Army. A big financial boost for them, and maybe can take them all the way out into retirement.
Right.
So that's been a big one. The other one, of course, is the fact that as beautiful as breasts are on women, they're not that good looking on men. So men who are growing breasts, we help them out with this is called gynecomastia medically. So a lot of these guys come in with the breast development,
Right.
and we're able to fix that with liposuction, cutting out some of that tissue, for the teenage guys, it really means so much more.
Yeah,
I think the same way you
absolutely.
say about these women who are suffering.
Right.
These kids, I mean, they can't take their shirt off. They can't go to the pool. They're just not enjoying their childhood the way they should.
Yeah.
And so by reducing that, just to see them come back in the office and you say, all right, take your shirt off, and they just take it off right away. And they leave it off for the whole visit. I keep them from walking out of here with the shirt off because, like, come on, man, keep it decent, all right? But that just means that they have confidence now.
Absolutely.
And that's wouldn't you say that confidence is kind of what we sell
No,
here?
Absolutely. Absolutely.
Yeah, I mean, it just gives us a lot of joy when that actually happens. You know, you see people with that swag again because they look good and they know they look good. You can't knock them down. So we've got the gynecomastia, the liposuction for the midsection, and then, you know, as guys get older, they're going to get some of the same facial concerns as the women. And we talked about that liposuction and thermoplasty. I think that's a good option. A lot of guys will start to get this kind of turkey neck, and the neat thing about that is that for the guys, we can actually cut that out a little easier than we can for the women because our skin is can hide a scar better in this area, and women don't want to have scars in their neck. So there's a lot of opportunities to help guys out, And we are seeing a lot more guys come in for Botox. One of them is breast augmentation, and of course that's always associated with plastic surgery, making breasts larger. It's a lot of fun. Patients come in with all different sizes. Some are, just out of their teens or late teens, and they've never had breast development. And just to see the joy and their ability to wear clothing and swimsuits after having even a modest improvement in their breast size. Others have had children, and they used to have beautiful breasts, but now things have gotten long. They're ready for that mommy makeover. So just adding that volume, making their breasts larger, will fill that skin up and give them the perky breasts that they want. Lastly, some patients will also have extreme droopiness of the breast that we call ptosis. So they'll also need a breast lift in addition to implants in order to make their breasts larger and more attractive. The other procedure that we do a lot of is breast reduction surgery. So here we are, we're taking small breasts, making them bigger, taking big breasts and making them smaller. But the patients who have breast reduction, their problem is neck, back, and shoulder pain as a result of these large breasts and the type of bras that are needed to carry them. So insurances will cover the procedure for breast reduction surgery. This is about a 90-minute procedure, much less painful than you would think, and the satisfaction rate for breast reduction surgery amongst all plastic surgeons is well over 90%. Why is that? Well, for one thing, you're going to feel a lot better, and you're going to look a lot better. You're going to be able to buy bras that fit. You can even go without a bra. If anybody listening to this has suffered with large breasts, they know exactly what we're talking about. Tummy tuck is a procedure that we do here in our office, just like we do the breast augmentation. I've got an ambulatory surgery center where we do these procedures. It takes about 2.5 to 3 hours, and there is a recovery time. All these procedures require about 6 weeks before you go back to full activities, but it's really the first 2 weeks where you have to be very careful. One of the more popular procedures that we're getting asked about is the Brazilian butt lift, because thanks to J-Lo and to the Kardashians, everybody's thinking more about their butt line. So what we're doing now is helping people to have a more accentuated buttocks by liposuctioning the areas around it and then adding that fat into the buttocks itself. So the buttocks not only comes out more, is rounder, and just more attractive. So this is a procedure that we're doing here at our ambulatory surgery center. It's about a 3.5 to 4 hour procedure. We want patients to be a little above their ideal body weight so we can suction off that extra fat, get those areas looking good, and have enough to put into the buttocks to get that round shape that they're really looking for. So that's an exciting, newer procedure that we're doing, and one that's developing a lot of interest and excitement amongst our patients and our prospective patients. As Sir Mix-a-Lot would say, I like big butts and I cannot lie. So come on in and get yours at Chattahoochee Plastic Surgery. We've talked about so many big procedures and scary things. There are a lot of things that we do that have nothing to do with aesthetics and making breasts bigger and so forth. One of those things, for example, is skin tags. People walk around with these skin tags that are annoying, they get caught in your clothing. Those are things that we can take care of here at Chattahoochee Plastic Surgery. It's simple, it's quick, it's easy, and a lot better than trying to tie a string around it. I had somebody say they bound it up in tape. I mean, don't do these home remedies. Come on in and let us take care of those skin tags, as well as moles and things of that nature. And as Dr. White was pointing out earlier, some of those can be dangerous and might be signs of malignancy or pre-malignancy, in other words, cancerous type things. So you should get them checked out. We're happy to treat those kinds of things here as well. All this time we've been talking here in our spa. This is called Naman Spa, and I'm here with my esthetician, Kaylee, and we're going to hear a little bit about what she offers here at Naman Spa. So Kaylee, what are your favorite procedures that you do here at Naman Spa?
Well, one of my favorite procedures would be chemical peels or microdermabrasions. I also offer waxing, facials, but I could say chemical peels would be my favorite.
Now, I've actually had a microdermabrasion. I thought it was pretty cool. So tell us how that works.
Well, what we do is we use a microderm machine, so it would just be putting crystals on your face to exfoliate. It helps with the fine lines and wrinkles, crow's feet, dry skin, so it'll just exfoliate the skin off.
Is it painful?
No, it's not painful.
Okay.
A little bit of downtime, maybe a couple hours just for redness and a little dryness.
Mm-hmm. And the chemical peels, how about that?
About a week downtime with that. Just because you would be peeling and flaking, so you wouldn't need to be out in the sun for that, so I wouldn't recommend in the summertime.
I've been seeing a lot of patients over here after they've had liposuction for a treatment that you do here. Tell me about that.
Yes, that's using excuse me, that is the tractive machine. It helps for swelling after surgery, so swelling and fluids. So a lot of patients come, even not having surgery, they get it done for cellulite treatment. Wow. It helps with the smooth the cellulite.
That's exciting. Mm-hmm. And then there are some areas where people's problems go beyond what we can do with the esthetician. So what do you recommend for people who need more than just what you can offer?
Well, we do offer Botox and fillers, so that will be a good treatment for,
Well, why don't I just talk about that for a little while? Sure, you're right, Botox and fillers. So yeah, they've been getting facials and all that stuff, and they're still getting these frown lines up here, and that's a great patient to use Botox on. So myself and our staff, including Dr. White, our nurse injector, Diane, and our PA, Shayna, all of them participate in using Botox for those things. And Botox is great because you'll inject into an area where you make frown lines, and within a few days, those lines disappear, and they'll stay gone for 3 to 4 months. I will warn you that you'll get used to looking better, and when 4 months comes up, you're going to want to come back and get some more treatment. So Botox is not only popular for these lines up here, but also for the lines in the forehead from raising your brows too much, like I always do over here. Also for the laugh lines that you get here. We call them crow's feet. Mm-hmm. So that's one of the good things about Botox. And then you mentioned also about fillers. So of course we use fillers in areas where the lines are too deep for things like microdermabrasion or ThermiSmooth to help with. So fillers will actually use hydroxyapatite, which is a chemical that your body is comfortable with, but will slowly break down over time. And that filler will help to smooth out those lines and give you a refreshed look, lasting up to 6 months or even longer in some patients. We have something special for you before we go. We want to offer you our tip of the day. So Dr. White, have at it.
All right, we actually have 2 tips. The first is that remember that summer bodies are made in the winter. So it's wintertime, come on in, get that liposuction, your breast augmentation, whatever else you may like. My second tip is that it's really important to protect your skin. Skin cancer is still really common, melanoma, basal cell, squamous cell. So get your skin checked, especially if you're prone to having moles. Also make sure you're wearing sunscreen.
You used up all my tips. That's okay. I've got a tip also. Listen, there's a lot of bad things associated with smoking. But many people don't realize how much smoking ages your skin. Mm-hmm. I've been in practice 21 years, so I've got to see my patients over 2 decades. And those that smoke really start developing more lines, have a leathery look. I mean, think of a better habit than smoking if you can, because that's really not going to help you with your skin.
Hey, I'm Dr. Vince Naiman, a board-certified plastic surgeon. I'm going to answer some questions about plastic surgery for us today. First question, should I wait to have a breast reduction until after I have children? That's a very good question. A lot of women are concerned about whether they can have children and breastfeed after having a breast reduction. My answer is, if you're suffering with the neck, back, and shoulder pain associated with large breasts, then that's probably the time for you to get a breast reduction. Many of our patients who get breast reductions are in their late teens or early 20s and haven't even had a chance to have children yet, but they are suffering, and this will give them a great amount of relief. Later on, if they were to have children, their breasts are going to increase in size during pregnancy, probably go down in size afterwards. They have a very strong chance of being able to breastfeed. Anywhere from 50 to 70% of patients will be able to breastfeed after a standard breast reduction. So those are the benefits that you can enjoy after having babies. And keep in mind that there are some patients who maybe 15 or 20 years after a breast reduction still might need either another reduction or another lift. But if you're suffering, there's no point in prolonging that suffering just for the purpose of having babies. How do I calm my nerves the day before my surgery? Well, oftentimes patients will ask their surgeons if they can be given a prescription, maybe Xanax to take the night before surgery to calm their nerves. I personally believe in more natural ways of calming yourself, making sure you eat a good meal, stay away from alcohol, get plenty of rest the night before surgery, call a good friend, or talk to your office the day before surgery. Maybe ask some final questions to give yourself a sense of peace. So all of these can be helpful to prepare yourself for the big day. How many revisions to my breast surgery can I have before the scar tissue becomes too much of an issue or too risky to cut through? Generally speaking, revisional breast surgery can be done using the scars you already have. The benefit being that you're not adding new scars to the patient in doing these revisions. However, those scars can become difficult to work through, whether it becomes thick or oftentimes it can become very thin. Oftentimes the scar can become retracted or pulled in. In those cases, we usually will try a new area to make a decision. So even though you're having more scars, it's better than taking the risk of operating on a scar too many times. So it does become an issue in some patients where we have to use a brand new site to do revisional breast surgery. But the final result would have been worth it in most cases. Can I get a procedure to strictly decrease my areola size? Trying to decrease areola size is a form of a mastopexy. It's like a breast lift, but just by reducing the areola. It's uncommon, but we oftentimes will do it. It can be done with just a scar around the areola, and oftentimes it can be done with a scar on the areola and a vertical scar beneath it, what we call a lollipop incision. So all mastopexies will reduce the areola if it's needed, and if all you need is the areola reduction, that can be done as well as a modification of a breast lift. Do you approach a rhinoplasty differently with each ethnicity? A rhinoplasty is surgery to change the appearance of the nose. So each person is going to come with a different nose to start with and a different sense of what a nose should look like. And a lot of times it has to do with their ethnicity. So it's important for me to talk to a patient and understand, are they trying to change their basic structure of their nose or just trying to improve the nose they already have? So we look at pictures to give us a good idea about what their goals are and what we can do to help them to achieve it. So that would be different for an Asian nose, for a Caucasian, for blacks, even for someone who's of Greek descent may have a whole different nose than somebody from lower Europe. So all of that is taken into consideration in planning for a rhinoplasty or nose surgery.
Welcome to Chat Plat with Dr. Naaman and Dr. White at Chattahoochee Plastic Surgery, located at 2430 Brookstone Center Parkway in Columbus, Georgia. Walking into a plastic surgery office can be intimidating, often making one nervous about the prospect of having surgery. To provide their patients with the utmost comfort and care, Dr. Naaman and Dr. White at Chattahoochee Plastic Surgery specialize in cosmetic and reconstructive surgery. Their goals are to have their patients feel comfortable and at peace from the moment they arrive at the office. The layout and decor have been chosen with you, the patient, in mind, creating what they hope is a warm and inviting atmosphere. As education is the main focus of an initial consultation, they use media and technology as a complement to their staff in providing the information needed to make a decision about the procedures in which you are interested in. The Surgery Center, also known as Brookstone Ambulatory Surgery Center, and the spa known as Naaman Spa are adjoined to our building for your convenience. Chattahoochee Plastic Surgery is located at 2430 Brookstone Center in Columbus, Georgia.